They voted to stop the lake of fire, and that's where it ends, Mr. Speaker. Yesterday, answering questions about her broken promise to retain seniors' drug benefits, the Premier said, and I quote, "We saw the opportunity in the last 12 months to do something better than what was in place before." But, Mr. Speaker, the new plan is similar to the old plan, which she promised seniors she would reject. So my question is to the Premier. How is forcing thousands of seniors to pay an arm and a leg for prescription medication better for them?
Mr. Speaker, this is wild speculation. The pharmacare program that will be introduced and developed with community stakeholders is providing better access to Albertans right across this province, whether they are seniors or not, Mr. Speaker. We know it's important to ensure that people have access to medication. We also know, Mr. Speaker, that it's important for that medication to be affordable, which is why we're doing the work with respect to the costing of generic drugs. What we would like to see from the opposition is some thoughtful consideration of an integrated plan that will actually serve Albertans better, which is exactly what we're delivering, Mr. Speaker.
Thank you very much, Mr. Speaker. Well, they're cutting $180 million out of the program and spreading it over more groups. So clearly thousands and thousands of seniors are going to lose their drug coverage, Mr. Speaker, directly contradicting what this Premier said in the last election. So will the Premier do the right thing and reverse this cut and retain the existing seniors drug program?
Mr. Speaker, we don't think that the existing plan serves Albertans well. We're going to ensure that we move forward with pharmacare, Mr. Speaker, because this allows us to put in place a sustainable plan for public health care that allows for people to get support for medication with reduced deductibles, Mr. Speaker. That's what matters to Albertans, and that's what we'll continue with.
Honourable member, Mr. Speaker. This is a budget cut, not a better program. Seniors shouldn't have to pay for this government's broken promises. Instead of continuing to break your promises, Premier, why don't you do the right thing and reinstate universal drug coverage program for Alberta seniors and then extend it to others?
Mr. Speaker, this is exactly why we need to introduce these changes. We can't keep going back, and whether it's the Leader of the Opposition or the Leader of the NDP opposition, what we can't do, Mr. Speaker, is to continue to maintain the status quo, or worse still, revert to programs that worked 20 years ago when there were 2 million people in the province. We are a growing province. We know that we have a thriving economy. We know we have vulnerable people in our communities, and this pharmacare plan is going to support seniors and youth and provide access to 20% of Albertans that can't get medication now, Mr. Speaker.